exciting, and actually, finally, I guess I could say the word, it's finally happening, and I'm very, very delighted about this. This is something that Kirk and I have been working on and thinking about for more than just the last 4 years. So it's really a special day, and Carl said it's not raining, so we're very happy about that. But this medical office reflects kind of what we want to do with the community. It's really going to help support those in the southwest area, those in the kind of the Roseland area and kind of the West County area, to be able to get care here, to get the best service, the best quality care right here on this campus. And then it also is a bridge to the community. I think by opening this up, you're going to see just a lot of other things are going to happen. This is going to be really a thriving area within the community. So actually, there's a building over there which we're going to eventually, in the next 6 months or so, house 60 behavioral health providers and then 60 physicians here on campus. And it is going to be a centerpiece, I really think, of this county, the West County. So I'm thrilled and excited. So with that, let me introduce Dr. Kirk Pappas, who's our physician-in-chief.
Great, thank you. So 5 years, 6 months, and 18 days ago, when I got the job that I have, Judy and I had a vision for having a presence in Southwest Santa Rosa. And that was even before we knew about the ACA and how that would create more insured lives in this area, both in Southwest Santa Rosa, in Roseland, and in the West County. And I think it's part of what Kaiser Permanente has always wanted to do, is bring care closer to people. Over 70 years ago, our founder, Sidney Garfield, went into the desert to take care of aqueduct workers. He left USC in the city of Los Angeles on that mission. So having a building here, a 3-story building, primary care, specialty care, lab, x-ray, pharmacy, a health education center, a learning center around technology, is part of what people like Sidney Garfield and Henry J. Kaiser envisioned over 70 years ago. You know, as I was driving here, I saw many, many people who work in the area, probably many of whom didn't have insurance 5 years ago, that now have insurance. And almost all of them have this thing in their pocket called the smartphone. And one of the things we're going to do here in this new medical office building, and then in all of our new medical office buildings, is have a technology center. And this is where you can teach people how to leverage technology to improve their health. We can have our patients go online and watch a telenovela in Spanish about their prevention, to know how to do a fit kit to help them prevent getting colon cancer, or take away the stigma of worrying about cancer coming in to get women's health care. People can do that from their own smartphone. We can teach them how to do that, and they can also refill their medication. They can actually see all the results of their labs, see their medications that they're on, and in addition, if they don't want to drive and come here, they can even do video visits with their physicians through their smartphones. So I don't think Sidney Garfield 75 years ago envisioned video visits, but he wrote an article in Scientific American in the 60s where he said the computer was going to change medicine more than the advent of anything else in the last 100 years. At that time, the computer was half as big as this area that we're standing here and had the same technology as my Fitbit. And now there's so much we can do. So having this medical center here, together, 120 clinicians, social workers, psychologists, psychiatrists, physicians, 60, over 100 offices, LEED Platinum, electric negative they call, electric zero they call, where we generate our own electricity. That's what Sidney Garfield envisioned, that kind of a future. And I really appreciate you being here.
Thank you, Judy. Kirk, I want to introduce some of our elected officials. I'm going to just introduce all of them first, and then ask Efren to come up when I've introduced everybody. So I'm going to start with Melissa Apuya from Mark Levine's office, one of his district representatives, and Ed Sheffield from Jim Wood's office, also a district representative and a new Board of Education member.